Have you ever noticed rough, scaly patches on your skin that just won't go away? Maybe they're pink, red, or even a bit brown. If so, you might be dealing with something called actinic keratosis. This is one of the most common precancerous skin conditions, and while it might not seem like a big deal at first, it's important to take it seriously. Today we're going to talk about what actinic keratosis is, what causes it, how it's diagnosed, and most importantly, how to manage it effectively to reduce your risk of developing skin cancer. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Actinic keratosis, also known as solar keratosis, is a skin condition caused by long-term exposure to ultraviolet or UV radiation from the sun or tanning beds. These rough, scaly patches develop on areas of the skin that get a lot of sun, like the face, scalp, ears, neck, arms, and hands. While they may start as small, dry patches, they can grow larger over time and may even become tender or inflamed. The biggest concern with actinic keratosis is that it can sometimes turn into squamous cell carcinoma, a type of skin cancer. That's why early detection and treatment are so important. So, who's at risk at developing actinic keratosis? Certain factors make some people more vulnerable than others. The number one risk factor is prolonged sun exposure. If you've spent a lot of time outdoors without proper sun protection, whether for work or leisure, your chances of developing actinic keratosis increases significantly. People with fair skin, light-colored eyes, and blonde or red hair are more susceptible because their skin has less melanin, which provides some natural protection against UV damage. Older adults are also at higher risk because sun damage accumulates over time, meaning the longer you've been exposed, the greater your risk. Having a history of sunburns, especially severe ones that cause blistering, further raises the likelihood of developing actinic keratosis. If you have a weakened immune system due to medical conditions like HIV or from taking immunosuppressive medications, your risk is also higher. And let's not forget about indoor tanning. It exposes the skin to concentrated UV radiation and significantly increases the risk of developing actinic keratosis and skin cancer. Now, let's talk about the symptoms. Actinic keratosis often begins as a small, rough, dry patch on the skin. It might feel like sandpaper when you run your fingers over it. These patches can be pink, red, tan, or even flesh-colored. Some may appear slightly raised, while others might be flat. Over time, they become more noticeable, scaly or crusty. They might even itch or burn. In some cases, they develop into thickened or wart-like growths. The tricky thing about actinic keratosis is that it can sometimes be hard to spot, especially in the early stages. You might not even notice these patches unless you're really paying attention. This is why regular skin checks are crucial, both at home and with a doctor. So how is actinic keratosis diagnosed? A doctor can usually identify it just by looking at your skin. They may use a magnifying device called a dermatoscope to get a closer look at the affected area. If there's any concern that a lesion might have progressed to skin cancer, the doctor may perform a skin biopsy. This involves taking a small sample of the lesion and sending it to a lab for analysis. The biopsy helps determine whether the lesion is still in actinic keratosis or if it has turned into squamous cell carcinoma. In most cases, a visual examination is enough to make a diagnosis, but if there's any doubt, a biopsy provides a definitive answer. Once diagnosed, how do we treat actinic keratosis? The good news is that there are several effective treatment options available. The best approach depends on the number, size, and location of the lesions, as well as your overall skin health. One common treatment is cryotherapy, which involves freezing the lesion with liquid nitrogen. This causes the abnormal skin cells to die and the treated area eventually peels off. While it's quick and effective, it can cause temporary redness, blistering, or scarring in some cases. Another option is topical medications, which are often used for patients with multiple lesions. These creams or gels, such as 5-fluorouracil or 5-FU or imiquimod, work by stimulating the immune system to attack the abnormal cells. The downside? They can cause redness, irritation, and peeling as the skin heals. But the benefit is that they treat not just visible lesions, but also microscopic ones that haven't fully developed yet. For more widespread actinic keratosis, photodynamic therapy, or PDT, is another effective treatment. This involves applying a special light-sensitive solution to the affected area and then exposing it to a specific wavelength of light. The treated cells absorb the light and are destroyed. PDT is particularly useful for treating large areas like the face or scalp, but it can cause temporary burning, redness, and peeling. Some patients prefer this option because it offers excellent cosmetic results once healing is complete. For patients with numerous or recurring lesions, a doctor might recommend laser therapy, chemical peels, or even minor surgical procedures like curettage, which scrapes off the affected tissue. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics or questions you want covered in future videos. Anyway, while treatment is essential, prevention is just as important. The best way to reduce your risk of developing actinic keratosis is to protect your skin from UV radiation. This means wearing broad-spectrum sunscreen with an SPF of at least 30 every single day, even on cloudy days. Make sure to apply it generously and reapply every 2 hours if you're spending time outdoors. Wearing protective clothing, such as long sleeves, wide-brimmed hats, and sunglasses, can also help shield your skin from the sun's harmful rays. Avoiding tanning beds is crucial, as they expose your skin to high levels of UV radiation and significantly increases your risk of skin damage and skin cancer. And don't forget to perform regular skin checks at home. If you notice any new or changing lesions, make an appointment with your doctor for a professional evaluation. One important thing to remember is that if you've had actinic keratosis in the past, you're at a higher risk of developing more in the future. That's why ongoing skin monitoring and sun protection are key. Regular doctor visits can help catch new lesions early before they progress to something more serious. If you're concerned about a spot on your skin, don't wait. Early treatment is the best way to prevent complications. So, to sum it up, actinic keratosis is a common precancerous skin condition caused by sun exposure. It appears as rough, scaly patches on sun-exposed areas and, if left untreated, has the potential to turn into skin cancer. Diagnosis is usually straightforward, and there are multiple effective treatment options, from cryotherapy to topical medications and photodynamic therapy. But the best way to protect your skin is through prevention, using sunscreen, wearing protective clothing, and avoiding excessive UV exposure. If you've ever been in doubt about a spot on your skin, it's always best to have it checked by your doctor. Thank you for watching. As always, take care of yourself and make the most of your day.